When the middle joint of your finger bends down and the fingertip bends backwards, it may be more than just an injury. This condition is called Boutonniere Deformity, and early treatment can make all the difference. With timely care, recovery is an absolute possibility. This happens when the central slip tendon is damaged due to injury or arthritis. Without treatment, the deformity may become permanent. Early cases are treated with a splint that keeps the joint straight for 6 to 8 weeks. After healing, hand therapy helps restore strength and movement. If splinting doesn't help, surgeons may repair or reconstruct the tendon. Recovery includes splinting and months of therapy. With proper treatment, most patients regain normal or near normal function. Surgical cases also show excellent long-term results. After surgery, rehabilitation is essential. With proper care, many patients regain significant movement and functional use of their fingers. If you're unsure about your symptoms or need expert guidance, teleconsultation really makes specialist access so much easier. You can connect with top hand specialists to review your case and get expert guidance from home. MediGence helps you book virtual consultations, get second opinions, compare treatment costs, and even access rehab support. A boutonniere deformity doesn't have to limit your life. Visit www.medigence.com to explore your treatment options today.